Hi, Dr. Ortiz. Thank you very much for joining us today and sharing some of your experiences about PeriActive. For the audience, Dr. Ortiz is a very well-known and highly respected periodontist practicing in Dayton, Ohio. And perhaps, Dr. Ortiz, you'll introduce yourself and give us some of your background before we get started.
So thank you for inviting me. My name is Dr. Gisell Ortiz-Ramsey. I'm a board-certified periodontist for more than 20 years. And I did my residency at The Ohio State University, where I obtained a PhD in oral biology.
Impressive. Not as impressive as your clinical skills, but impressive. For the audience also, Dr. Ortiz lectures all over the country and is extremely well known and respected by your periodontal colleagues. So, Dr. Ortiz, you've been using PeriActive in your practice now for quite some time. How long do you think it's been?
Well, I've been using PeriActive in our practice for over 6 years, and the experience have been very, very beneficial for our patients.
So, in your opinion, as a periodontist which specializes in gum diseases, how effective do you feel periodontist is in treating periodontal problems, and which periodontal problems specifically would you recommend PeriActive for?
PeriActive is very effective in the treatment of gingivitis, the bleeding of gums, and I've been very effective for my patients using it post-surgical after periodontal surgery for the treatment of gum disease.
So what percentage of your patients would you say that you put on PeriActive, for example, either for immediate care or probably even for long-term maintenance?
For long-term maintenance, probably like 60 to 70% of our patients are in PeriActive.
Yeah, so that's really the bulk
now.
of your practice. So thank
Yes.
you. How would you compare PeriActive in terms of its clinical benefit, since you clearly are in favor of the product, when comparing it to some of the other over-the-counter products that would be available to patients?
So PeriActive is very effective with compliance. Basically, patients liked it and they continue using the products, which, as you know, as a periodontist, we have issues with compliance, which hinders our effectiveness as a provider for our patients. So they use it, they like it, and they continue using it.
I mean, I know patients like the taste. In fact, frankly, I find in my practice that the patients feel the difference in their mouth and are aware that when they don't use it, a lot of the inflammation begins to return. Do you find the same thing?
Yep, I find the same thing. Actually, I have an anecdote. I have a patient that she was actually having some bleeding gums issues, and so she started using PeriActive, and she loved it. But also, she was having recurrent after ulcers. And then she came, she ran out of her PeriActive. She came to the office and I said, "Doctor, my after ulcers came back." And I was just like, "Why?" She's like, "Yeah, I stopped using PeriActive and my after ulcers came back." So now she's a fan also because of their after ulcers control.
Probably addicted at this point.
Yeah.
So then basically, I get the impression that you use the PeriActive for the bulk of your patients in the practice. Do you start them on PeriActive from when they begin treatment with you and continue from there? Because in my practice, I don't limit their use at all.
So usually we use it after initial therapy, after scaling or replanning, and after periodontal surgery. Most of patients do not like the alcohol content in other products, and most of my patients are looking for a more natural homeopathic way to treat the disease. So it fits very well with our practice model.
Fantastic. So, Dr. Ortiz, would you say your PeriActive has become an important part of your practice?
Oh, yes, definitely.
I couldn't agree more. So I'll take it as that you're actually a supporter of the product and look to continue using it in the future.
Yeah, definitely. I'm supportive of the product and definitely will keep using it in our practices.
So I would classify you as a qualified fan of the product.
Yes, I'm Dr. Ortiz-Ramsey, and definitely I'm a PeriActive fan.